A few of them came in Lagos. Unknown to us, some of the people that were against this management were our colleagues, our physician colleagues, and our nursing colleagues. So when the patients have accepted them in Lagos, by the time you go back to see the patient, did your mother have to do that for you? We did the level, why can't you push your baby out? So you don't have your baby. And the woman will support and refuse. But I want to remind all of us, because I know, if not all, most of us are Christians. Galatians chapter 3 verse 13, the Bible record that Christ has been us of the cause of the Lord. One of my colleagues, we were pressing one day in the theater. He's an obstetrician gynecologist. When we were residents, he said, do you know that if labor was done by God, the wife will get pregnant the next time, the husband will get pregnant the second time, the maximum number of children in the family will have is 3. I said, why? He said, because the wife will go the first time, come back. The husband will go, come back. The wife will go again, when it is the time of the husband will say, no. We have ultrasound guided nerve blocks. So we have domesticated better places blocks. So if you're coming to a hospital and you're having surgery on the hand, you can actually just block the hand. You're having something on the abdomen, you can actually do the transabdominal plane blocks for you to obtain general anesthesia and give you very good pain management. Thanks again to my capacity medical director. Thank you, sir, for helping us to get that ready. It's only once. This next slide is one of those patients. This is the pamphlet I was talking about. That's why I said everybody is in no. Okay. So that's why I'm saying everybody is involved. But I read this pamphlet and I saw that Java from my sister. I told them I want to make 5,000 of this pamphlet and they did it for us. And I know that there are people in this hall. After this meeting, they will come and say, what can we do to improve your department? This is one of the patients that came from Adeba and Nigeria. She said she wanted to come here and share her story. And this is one of the children that was delivered. This is our state-of-the-art intensive care unit. And we have managed several things. One of the issues I want to bring to us is that all these over-the-counter drugs we are taking have serious side effects. We manage a patient who has gastric inflammation as a result of all these industries, butazolidine, diclofenac, therodine. You just go to the pharmacy to visit, you can't find it. Then you go. How about the side effects? So unfortunately, we have this patient, we are able to manage the patient successfully. You can see the entrance to our intensive care unit and the inside, the peak into the inside of our state-of-the-art intensive care unit. We seriously need partners to help us have uninterrupted power supply. Please come and adopt a bed in our ICU. Thank you in advance. The next slide shows some of my students who are now dentists around the country. The next one shows some of my resident doctors. Again, I want to thank my team medical director. Thank you very much. I want to announce to this August audience that when I finished my tenure as the chairman medical advisory committee, I went back to my department. I had 35 resident doctors. Out of the 35, about 5 of them passed their fellowship exams. As I speak to you, the rest Japan. Saudi, because there was a lot of pull factors, financial pull. Some of them moved to London and other places. But this CMD employed for me these young men and women. And together with the consultants in the picture below, we were able to train them. As I spoke to you, sir, in the last 2 fellowship exams of both National and West African College of Surgeons, I recorded 100% pass. So, what are my recommendations? My Vice Chancellor, please, have a very big group in my department, and I have moved into my department in the faculty. I want us to have equipment for the simulation room so that we can practice pain management and other anesthetic skills on management before trying on our patients. I want more lecturers to be employed for the department. As I speak, out of the 5 lecturers, 2 are due for retirement in the next 2 months. And I don't know how we are going to cope. The issue of remuneration should be looked into with a view to improving it to prevent further exodus of doctors to greener pastures. None of the young consultants is willing to join a lecturer. What they say, when they join, their salary drops. Patients with pain should request referral to the pain clinic, and clinicians should take advantage of the services of the pain clinic. Corporate bodies and individuals should collaborate with the department and sponsor equipment, conferences, research, and sub-specialization in anesthesia, intensive care, and pain medicine. Lastly, I want to recommend that in recognition of the enormity of the work done by the department, the hospital, which is the laboratory of the college, has graciously approved the change of the name of the department to the Department of Anesthesia, Intensive Care, and Pain Medicine. Can we change it in so that it can be uniform? In conclusion, pain is a common symptom in clinical medicine. Patients must know how to report their pain, and clinicians how to take a history, evaluate, and document pain severity using appropriate pain assessment tools. As an alarm system of the work, it is not enough to silence the alarm using pharmacological and non-pharmacological techniques. It is important to identify the cause of pain and eliminate it where possible. When not possible, multimodal and analgesic techniques should be sought, and patients referred to the pain clinic for appropriate care by a multidisciplinary team. Pain is subjective. It is what the patient says it is, and exists wherever he says it does. Healthcare workers must review the patient's report. Thank you very much.
day of 27th March 2024. Congratulations.
Thank you so much. Can we put our hands together for the freedom and Thank you so much, ma'am, for that educating lecture. If you're in the program, before I go to the next item on the program, please kindly to recognize the present, the former Commissioner for Information and Orientation, former Commissioner for Performance, currently, and a former Director of Administration, UCTH. She's not the person, Pastor Mrs. Rosemary Achibong Esquire. Please put your hands together. You're welcome. The recognized and welcome. Always beautifully dressed. Welcome, welcome, madam. May I most respectfully invite to the podium response presentation of standard first aid box to the university by the excellent lecturer. Can we put our hands together for her? She has a first aid box to present to the university.
Henry, please bring the box. Thank you very much. A distinguished audience, my Vice Chancellor. A few days ago, I was at the research fair, very beautifully put together by the university. And please, there's a first aid box on the chair. Please, can you bring it for me? Okay. So please, I was at the fair, and while demonstrating CPR, fortunately, the Vice Chancellor came to my stand, and she asked because I was telling them the importance of the automated external defibrillator. And she asked, do we have one? And the answer was no. I had informed that August gathering that in a Senate building like this, where we mostly have elderly people coming, we must have an AED. And I thought I would have enough money to buy an AED. But as a holding procedure, keeping faith with the Vice Chancellor, who has promised that at least we have an AED in the medical center, we will be able to do something to keep the patient alive while the AED is either coming from the medical center or the patient is going from here to meet it. I feel obliged to do this because I don't know how many people are privileged to give 3 lectures in this August building, but I am one. A few years ago, yes, thank you very much. In 2013, the Faculty of Allied Medical Sciences, ably led by Professor Anna Supo as Dean, decided to start a wellness campaign in the Senate, and they were having 10-minute lectures in this Senate hall. I was privileged to be the very first to be invited to give that lecture on work-life balance. About 2 years ago, I think the college absorbed that program from the Faculty of Allied Medical Sciences, and it was led by Professor Ima Bonketu. And she invited me to this same hall to speak on basic life support, a must know by all. And today, I stand here as the faculty lecturer of the Faculty of Clinical Sciences in this same building. So, Madam Vice Chancellor, I want to donate this first aid box as my token of appreciation for this honor on me, and also for the wellness of the people who use this building. Please, ma'am, can you kindly come and collect everything? On behalf of myself and also my department, students at this lecture, I want to present this box contains the self-inflating bag, the pulse oximeter, an endotracheal tube, a laryngoscope, and all the other things that we need. Thank you very much.
I wish to appreciate the faculty lecturer who has not only told us on how to manage pain, but has made a first step in ensuring that we handle emergencies rightly. I was there when you asked about the ABD, and we have a promise. It's about our health. It's not any political request. And anything about health should be taken seriously. And as a university, we will definitely rise up to that challenge. And also tell you during the fair that the demonstration then needs to be brought to the Senate, because we know that when people jump at any time, anywhere, the first thing the public reacts with is their handset. They take a snapshot instead of trying to resuscitate the person. So we need to know what to do. And we are going to invite you again. You will demonstrate to us how to resuscitate people that faint in both, and ensure that we all get to know what to do. So once again,